Welcome to Naturally par José, a podcast about health and well-being. I'm your host, José Fortin. Today we are going to talk about the health of our heart and the circulatory system in general. Our cardiovascular system is a system whose signs of imbalance are often very subtle until the problems becomes more serious. So by the time we realize that something is physically wrong, the problems have often progressed greatly and medical intervention may be necessary. The goal today is to be more preventive or proactive with the health of our cardiovascular system and to help it even before more serious problems arise. If you already have more serious imbalances, there are still things you can do to help improve the situation, but be careful to check for any interactions before taking supplements with the medication you are currently taking, as heart medication and especially blood thinners have many possible interactions with different substances. If we describe the cardiovascular system simply, it is a system that uses the heart as a pump to propel blood throughout our system via blood vessels for the transportation of nutrients, building material, regulating factors, and waste material. In ancient Egypt, it was popularly believed that the heart was the central element of the body and not the brain. This is why the heart was preserved after death with advanced embalming techniques, while the brain was simply discarded. Blood allows the transportation of oxygen and a variety of elements directly to our cells to promote their proper functioning, as well as the transportation of waste and CO2 produced by our cells to the organs of elimination, which are the lungs, liver, kidneys, intestines, and skin. Blood contains a variety of elements that serve as transport vehicle for many nutrients absorbed by our digestive system, compound produced by different organs of our body, and oxygen from the lungs. For example, red blood cells serve as a transport vehicle for oxygen and CO2. Lipoproteins carry cholesterol and other lipids in the blood. And there is a variety of proteins that can attach to various elements and allow them to be transported more efficiently. Some elements can circulate freely in the blood without attaching to anything, such as most hormones. The exact red color of the blood can vary, and this is directly related to the concentration of oxygen it contains. The brighter red the blood is, the more oxygen there is. The darker red it is, the less concentrated it is in oxygen. The heart is the engine or large pump that propels blood throughout our body using the blood vessels to which it is attached. It is composed of 2 atria and 2 ventricles, with valves in between each to prevent blood from backtracking as this powerful muscle contracts and propels blood. It is the closing of these valves that we hear when we listen to the beating heart. During a typical lifetime, the heart beats about 2.5 trillion times with an average of 70 to 80 beats per minute. Women tend to have faster heartbeats than men, but this is mainly related to the fact that most women are smaller than men. An independent electrical system is responsible for triggering the heartbeat. This electrical system can be influenced by the sympathetic or parasympathetic neurovegetative system to speed up or slow down the heartbeat, but it can function completely independent of our nervous system. It is for this reason that a heart extracted from a living human body can continue to beat as long as it receives the oxygen and nutrients necessary for its functioning. There are 2 atria and 2 ventricles in the heart to help propel blood into 2 different parts of the body. The right atrium and right ventricle are slightly smaller and are connected to the pulmonary artery that sends blood into the small circulation, which is connected mainly to our lungs. It is here that the blood gets rid of harmful gases, and in particularly CO2, carbon dioxide, and replenishes its oxygen levels. The proper functioning of the lungs is then very important to ensure that this exchange takes place well. At rest, a circuit in the small circulation loop takes an average of 6 seconds. The left side of the heart is connected to the aorta, the largest blood vessels of our body, and which sends the blood to the rest of our body. Right after exiting the heart, the aorta is quickly divided into 5 parts. The coronary artery, which specifically nourishes the heart muscle and ensures its continuous functioning. The arch of the aorta, which divides in 3 sections, nourishes the brain and both arms. The thoracic aorta, that nourishes the upper section of our torso. The abdominal aorta, that nourishes the lower section of our torso. And finally, the primitive iliac aorta, that nourishes both legs. Blood pressure is the measure of the force used to pump blood through our arteries and particularly into the aorta. Blood pressure is measured in millimeters of mercury, and an ideal pressure is 120 over 80 milliliter of mercury. The first number, called the systolic pressure, is the measure of the pressure in the aorta when the heart contracts, while the second number, called the diastolic pressure, is the measure of the pressure in the aorta when the heart relaxes. We should always take at least 10 minutes of relaxation time before taking our pressure, as it should always be assessed at rest for accurate monitoring. The blood then goes through the big circulation circuit to bring all the essential elements for the proper functioning of our cells, as well as collecting the waste that they must get rid of. And just before the big circulation circuit returns to the heart, the blood passes through the digestive system, the liver, and the kidneys to get rid of the waste material coming from the body cells and replenish the blood with nutrients and many other elements essential for the proper functioning of the body, such as hormones and other components. So in summary, blood vessels are the transport pathways that connects all areas of the body to each other and promote exchanges. The largest vessels are like highways that do not allow exchanges with cells but are used to quickly transport the different elements to the regions where the body needs them. The smaller the vessels, the more the circulation slows down and serves specific areas. Arteries are the transport pathways between the heart and the cells. Their walls are thicker, allowing more pressure to be taken to quickly bring blood to where the body needs it. These vessels must still maintain a certain elasticity to be able to absorb the increases in pressure on their walls each time the heart contracts, without increasing the risk of rupture. At the cellular level, blood vessels are so small that they are called capillaries. Red blood cells, which are 8 microns in diameters, are flattened into an oval to be able to squeeze into the capillaries. It is in the capillaries that exchanges take place. The walls are 1 cell thin, which allows a quick transfer of elements, but they are also more fragile. Typically, the blood pressure in capillaries is very low, allowing a slowdown in blood flow sufficient to exchange different elements with the cells. After this exchange, the blood returns to the heart through veins. Blood vessels with walls that are thinner than those of the arteries. The vein contains valves at regular intervals that prevent the blood from going backward. It is the contraction of the muscles in our body, like in our legs, in our arms, everywhere, that has the main role of ensuring good circulation in the veins. If you are not active enough and do not exercise regularly, the heart has to work harder trying to propel blood back to the heart. If all the blood vessels are attached end to end to form a continuous chain, it is estimated that they would extend over almost 100,000 kilometers. On the other hand, the body contains only about 5 liters of blood. So the contraction and dilation of blood vessels with the help of small muscles in their walls, play an essential role in sending blood to the areas where the body needs it most. This contraction and dilation of blood vessels can also play secondary roles, such as helping to control the body internal temperature. If it is very cold outside, the body concentrates internal circulation to the organs and less to the extremities to avoid too much heat loss. While in high external temperature, the body sends a lot more blood to the skin and extremities, which, combined with the sweating process, allow excess heat to be evacuated and help maintain a constant body temperature. Now let's look at the different type of problems associated with our cardiovascular system, and more specifically the heart. One of the most common issues are arteriosclerosis and coronary artery disease, which is a hardening of the arteries that occurs when plaque builds up on the walls of our arteries and eventually blocks blood flow. Plaque is made up of a mixture of cholesterol, fat, and calcium. It has been observed that this plaque is more prone to build up where the body overall level of inflammation is higher. We can help evaluate the overall inflammation level of our body by measuring the concentration of the C-reactive protein in circulation. This does not account for a local increase in inflammation and localized issues, but can give an overall overview. When we talk about coronary artery bypass surgery, the blockage is in the arteries of the heart, which greatly interferes with its functioning since it will impact the amount of nutrients and oxygen the heart cells will receive. In the more severe cases, a heart attack occurs when not enough blood reaches the heart. This is usually due to a blockage of the coronary arteries. If the problem is not resolved quickly, there may be cardiac arrest, and the person may die if the tissues of the heart are too damaged or the heart is not restarted quickly. Our brain cannot run out of oxygen for more than 3 minutes without serious damage. After a heart attack, cardiac arrest, or in an event of a blood clot, if too much of the heart tissue is damaged and does not work well, the person is considered in heart failure, a chronic and irreversible problem. Symptoms include fatigue, swollen ankles, increased need to urinate at night, rapid breathing, chest pain, and fainting. In these cases, it is very important to reduce any additional stress on the heart because the situation is serious and irreversible. We do not want to go to that stage, and that is why it is particularly important to do prevention. When looking at the heart health, another category of issues are related to its heartbeat rhythm. The heart can beat too slowly, then we're talking about bradycardia, too quickly, which is tachycardia, or in a disordered or irregular rhythm, and then we're talking about arrhythmia. In these cases, it often happens that the chambers of the heart do not empty properly, and there can be blood reflux or stagnation that takes place, which can increase the risk of blood clots. This is why doctors usually recommend anticoagulants in these cases. When looking at issues occurring at the level of the arteries, here again there can be arteriosclerosis of the peripheral vessels, and particularly arteries in the arms or the legs. This can be a source of pain, and it is very important to deal with these quickly as well because there can also be tissue damage occurring. And if it involves a large area, such as in phlebitis cases, it can evolve into gangrene and amputation of the affected area. Another problem that can be seen in the arteries is an aortic aneurysm. This occurs when the wall of the aorta weakens and form a bulge that can rupture and cause life-threatening internal bleeding if left untreated. This is why it is important to bring blood pressure back to normal levels as quickly as possible, and it is never a good idea to leave it too high for too long, so as not to cause excessive pressure on the artery walls and weaken them. It is a problem that can also be related to a birth defect, and in these cases it is rarely detected before it is too late, since it is an issue that does not present any warning symptoms. Blood clots can also cause issues in our circulation. A clot is a normal reaction of the body to a lesion in a blood vessel that serves to seal a leak and prevent bleeding. Sometimes they detach from the area where they form and can block an artery or vein further away, causing a blockage of the circulation in that area. The lack of oxygen then kills the surrounding tissues. When this takes place in our lungs, we speak of pulmonary embolism. If it takes place in our heart, we speak of myocardial infarction. In the legs, we speak of phlebitis, and in the brain, we speak of a stroke. There are certain risk factors that promote the appearance of blood clots. Some of them are venous insufficiency. If somebody is immobile too long, like if their lower limbs are in a stationary position for too long, taking certain medications such as the contraceptive pill or some corticosteroids, smoking, obesity, pregnancy, or even certain blood clotting abnormalities can be other factors increasing the risks. In the case of veins, the most common problems are varicose veins and hemorrhoids. Varicose veins are veins that become more visible on the surface of the skin and indicate that the veins are under greater pressure. Because of that pressure, they become more distended. Because the vein depends a lot on the proper functioning of the valves they contain to prevent the flow of blood from going backward, a distension of the vein walls, and by consequence the valves they contain, is very harmful. These valves can then no longer function properly since they can not close tightly anymore, which only compound the situation by adding even more pressure on the vein walls. It is then important not to fall into this vicious cycle and to keep our vein healthy, especially when it is already an issue observed in other members of the family, because this is often an hereditary issue. Other factors that can promote the appearance or worsening of varicose veins are standing or sitting for a long period of time, being overweight, pregnancy, age. The older you get, the more frequent varicose veins can become, and the sex of the person, since varicose veins are more common in women. Hemorrhoids are a distension of the vein of the anus or rectum area that can often cause discomfort or pain, especially when passing stools. The first cause of hemorrhoids is constipation, because when stools do not drain regularly, they tend to accumulate in the large intestine and increase the pressure on those veins and cause distension. Prolonged sitting also increase pressure on the anus. And finally, pregnancy can also be an important cause of the appearance of hemorrhoids. In this particular situation, it is even more important to avoid constipation since it only multiplies the risk of developing hemorrhoids. There are many other problems related to blood vessel dysfunctions, which can be associated with a weakness or inflammation of the blood vessels walls. Here are a few. Raynaud's disease. It is a reaction that occurs when the person is exposed to cold or an emotional disturbance. The fingers and toes then may turn white before turning blue and then red. Rosacea is characterized by a combination of inflammation of the facial capillaries and the appearance of skin rashes. Erectile dysfunction in men can sometimes be caused by a circulatory problem in the cavities of the penis. Muscle cramps can be related to poor circulation as well as a lack of magnesium or potassium. Finally, there is another circulation disorder that has long been associated with strictly an emotional cause, but has recently been accepted as a temporary circulation disorder. It is called stress cardiomyopathy, or better known as the broken heart syndrome, associated with the end of a relationship. This results in a condition characterized by temporary weakness of the heart muscle, which causes symptoms similar to those of a heart attack, including chest pain, shortness of breath, or arm pain. Fortunately, for most people, this is very temporary, and most recover from these symptoms. However, those who already have underlying problems, this may simply be the straw that breaks the camel back and can result in very serious consequences. It is a known fact that for older couples that are still very much in love, when one of them dies, the other will often follow not long after, and particularly if they already have health issues. This is the reason why this occurs. The pain of having lost the loved one will cause a weakness, an actual weakness in the heart muscle of the surviving partner. Now, let's see how to screen and do some prevention for cardiovascular problems. Many heart problems related to the cardiovascular system have no obvious symptoms and often go unnoticed until they are at an advanced stage. The risk of hospitalization and death from heart disease or heart problem increases in men from the age of 45 and in women from the age of 55. In the case of women, it occurs a bit later because estrogen level protects us from a lot of those issues until we get to menopause, when the switch in hormones will remove that protection. It is well known that blood pressure and cholesterol levels are ways to assess the risk of heart problems. High blood pressure, also known as hypertension, is a common condition where the force used by the heart when pushing blood through the arteries is constantly too high. The heart can then become exhausted more quickly, increasing the risk of cardiac arrest. The arteries experience higher pressure than they are designed for and are at higher risk of rupture. When the first number, the systolic pressure, is constantly between 130 and 139, or the bottom number, the diastolic pressure, is between 85 and 89, it is important to monitor more closely and start doing prevention because we are then having borderline hypertension. If the pressure is constantly more than 140 over 90, then you have high blood pressure, and it is very important to consult your doctor and make significant lifestyle changes to improve the situation. When the pressure is more than 180 over 120 millimeters of mercury, it is considered a medical emergency, and you must then be followed by a doctor urgently. When experiencing high blood pressure, some people may have headaches, shortness of breath, or nosebleed, but most people have no symptoms even when it is very high. This is why it is recommended to have our blood pressure taken at least every 2 years from the age of 18. But from the age of 40 or more, we should take it every year and even several times a year just to make sure that it doesn't go off the chart. Keep in mind that some people systematically have high blood pressure when it is the doctor who takes the blood pressure. It's called the white coat syndrome. So sometimes it's better to take it on your own at home in a quiet environment. Sit down and relax for at least 10 minutes before taking your blood pressure. We need to take it at rest. Now, let's look at our cholesterol levels as a way of assessing if we are at risk of a cardiovascular problem. Cholesterol is an essential element for our health. because it plays a very important role on several levels. First, it is the basic material from which we produce many hormones, including sex hormones such as estrogen, progesterone, and testosterone. Both women and men need estrogen, progesterone, and testosterone to regulate their sexual functions, but in different concentrations. It also serves to produce cortisol, which is one of our stress hormones. See episode 2. And it also is the main component for producing aldosterone, an hormone that plays on water retention by the kidney and can have an impact on our blood pressure. Cholesterol is also the material from which our body can make vitamin D. When cholesterol in our skin is exposed to UV rays, it can be transformed into one of the precursor of vitamin D that then goes to the liver and kidneys to be transformed into its final active form. Cholesterol also plays an important antioxidant role, helping to neutralize toxins before they can cause damage. This is especially important for toxins reaching the ovaries, which is why when cholesterol is low, the ovaries tend to form more cysts. It's a self-defense mechanism against toxins. Cholesterol plays an important role in the structure of cells, particularly brain cells. Both an excess and a lack of cholesterol can have a marked effect on brain health. Keeping everything in balance is especially important. Finally, cholesterol, and particularly the lipoproteins responsible for cholesterol transportation, are important for the remobilization of fats, for example, during weight gain or weight loss, as well as during the elimination or formation of cellulite. Only 20% of blood cholesterol comes from food, while 80% is produced by our body and mostly by the liver. That's why the total amount of cholesterol in our diet has less of a crucial impact than our body handles cholesterol levels. Some people talk about good cholesterol and bad cholesterol, but as we've already seen, cholesterol isn't bad as such. It's the way it's transported and other factors that cause it to form plaque in the blood vessels. It is transported in the blood by lipoproteins of various densities. High density lipoproteins, also called HDL, carry lower concentration of cholesterol accompanied by proteins, phospholipids, and a few triglycerides, while low density lipoproteins, known as LDL, contain much more cholesterol, less protein and phospholipids, and more triglycerides. Since there is a higher concentration of cholesterol in the low density lipoproteins, and they are accompanied in a higher concentration of less favorable fats, it is easier for these proteins to let cholesterol molecules go, particularly in areas where there is a lot of inflammation. These are factors that contribute to plaque formation. This is also why it is important to optimize our HDL levels and reduce our LDL concentration in the blood as much as possible. Hence, the term of good cholesterol when referring to HDL and bad cholesterol when referring to LDL. However, it is in the last 2 decades that we realize that these are not the only factors that cause cholesterol to become stickier and risk forming plaque in our blood vessels. Some people have normal level of lipoproteins and still end up having blocked coronary arteries, while others have very poor levels of lipoproteins and do not form plaque. So levels of systemic inflammation, free circulating triglyceride levels, and cellular insulin resistance are also factors to consider. In recent decades, the diagnostic of the metabolic syndrome as a tool for assessing the risk of developing cardiovascular disease has grown significantly, and the importance of proper blood sugar regulation in this type of problem has finally been recognized. And yes, it seems that excess sugars are the worst enemies of your cardiovascular system, since they are the main cause for cellular insulin resistance and the increase of triglyceride levels, two other factors that also have an impact on the formation of plaque. Metabolic syndrome, or also known as insulin resistance syndrome, has the following symptoms. First, there is an increase in fasting blood sugar levels. Normally, when blood sugar levels rise after meals, the body produces insulin to help cell absorb the excess sugar and use it to form energy in the form of ATP. When blood sugar levels become consistently high and the pancreas regularly produces insulin, the insulin receptors on the cell walls become less responsive to insulin and are slower to react, hence the cellular insulin resistance. In these cases, less and less sugar is absorbed by our cells while blood level rise. Our cell concentration in sugar is low, and they then send out signals to ingest more sugar, so we end up having cravings for sweets, bread, and pasta. But this only contributes to increasing our blood sugar level even more. When this situation becomes chronic and severe enough, we can then develop type 2 diabetes. Dyslipidemia is another factor of the metabolic syndrome. We then observe an increase in LDL, a decrease in HDL, and an increase in triglycerides. So there's an imbalance in our cholesterol level and in our triglyceride level. However, in the case of metabolic syndrome, it was also observed that all this is usually accompanied by a high concentration of C-reactive protein, an indicator of inflammation, another factor that can promote the formation of plaque in the arteries. Finally, this is usually accompanied by hypertension, abdominal obesity, fatigue, brain fog, and sometimes even fatty liver disease. So these are all elements that can help assess the risk of developing problems in the cardiovascular system, and the more element present, the higher the risks. So today we have observed the different elements of our cardiovascular system and things that can go wrong. We also determine how to evaluate our risk of developing problems with our heart and circulatory system. In our next episode, we will see how to help prevent these issues and eliminate some of those risk factors. Meanwhile, you can start by listening to my second episode on stress management, since it can be one of the contributing factors that causes imbalance in our cardiovascular system. In 2 weeks, we will see all the other improvements you can do to your lifestyle that could have an impact on your heart and circulatory system. Do not forget that this information does not replace the recommendations of your doctor, but should be seen as a supplement. It is always important to check with your health professional team to assess if you can make the changes you want to do in your particular situation, considering your health problems, and if you take any medication, you need to make sure there are no interactions with any addition to your health regime. If you enjoyed the information in my podcast, please subscribe to the platform you are using, and you can also activate your notification bell to be warned when I post a new episode, which usually should occur every second Tuesday. Thank you for listening, and let me know if some topics are of particular interest to you in the comments section. May you achieve health and well-being. See you soon.